Okay, and we're back. Sorry guys, nawagtangan ko og storage. Now, let us proceed. Next is our automated dispensing cabinets. Now, an ADC is a computerized point of use medication management system that is designed to replace or support the traditional methods of medication management. Now, class, many healthcare facilities have already replaced the old medication carts with automated dispensing cabinets. Simply put, sa una mong good class, back then, a normal medication cart is like this. Let's say for example, there is an emergency and you need norepinephrine. Magkuha kag norepinephrine gikan sa imong medication cabinet. Now, after you have given the norepinephrine, chances are mag-charting mamuana, di ba? Mag-charting pamuana. And then you also have to note no sa inyong inventory nga nagkuha ka og norepinephrine. You got norepinephrine. Now, in an automated dispensing cabinet, it works like this. Let's say for example kas sa inyong system na rin mga buttons. Okay? Nasa sa screen, nasa button. Usually touch screen, sana sila. Let's say mo ni siya ang norepinephrine. What you do is you just basically press this button and then after that, iridapit na part, you scan your ID. Because usually ka na mga IDs gawas na yung mga RFID, di ba? You scan your ID and then immediately the cabinet corresponding to norepinephrine will open and then you can just take one. This saves on time and this is very efficient because number one, dili ako mag-chart. Okay? It has already verified that I am the nurse that is taking through the use of my ID. Therefore, I don't need to chart it anymore. Aside from that, I don't need to edit the inventory anymore because it is already done by the system. This is very efficient, no? That is the good thing about our ADC. Next is an infusion pump. Now, an infusion pump class is very common in the hospital na. Nani siya sa infusion pump. There are three main kanang advantages to using an infusion pump. Number one is it reduces workload. It promotes accuracy administration and there is variable control. Now, ano makaingon man tanan sir? Let's say for example you are administering mannitol. Mannitol is an osmotic diuretic. Usually class mo tagtag mannitol around 50 cc. Sometimes we decide 100 cc. Okay, now that is too many. Daghan na kay na class. Kanang 500 cc, 100 cc. Chances are if you're gonna administer mannitol via IV, na chance actually there's a large chance that you might overwhelm the vein. Okay? You might overwhelm the vein and therefore basin mo close ang vein. Hindi mo magamit ang vein. Okay? That is the time where we use an infusion pump. Let's say for example, we should administer the 100 cc slowly at around 20 minutes. Okay? You should ato tagaag 20 minutes no to administer the entire 100 cc. No? What we do is we basically attach a 100 cc syringe here in the infusion pump and then we set it to 20 minutes. That way, this part class will slowly move and slowly administer 100 cc over 20 minutes. Diba? So that we don't overwhelm the vein. That promotes accuracy. Because of that, it reduces workload. Diba? Instead of being there, no? Ikaw na nurse. You are there for the entire 20 minutes slowly administering the medication. You are using the infusion pump to your advantage and thus ni-decrease ang imong workload. Aside from that, we also have variable control. When we say variable control, not only do we have control over variables such as time, diba, we can set time, we can also set the correct dose. Let's say for example, we only want to administer 50 cc. The system will do that automatically. Aside from that class, now I want to highlight because infusion pumps are usually battery powered. Okay? Battery powered, that means even if there is a blackout, dili na siya mapaong. That is very great. Next is healthcare data standards. Now, healthcare data standards are critical components in the development and implementation of an electronic health record. The effectiveness of healthcare delivery is dependent on the ability of the clinicians to access critical health information when and where it is needed. Diba? We have already discussed, no, if there is standards class to our data collection, data management, so on and so forth. If there is standards, chances are everything will stay, everything is standardized, everything is the same. Because of that class, there is interoperability. Interoperability. Okay? And because of this interoperability, since it can be used, no, by different systems, it allows the clinicians to access that information when they need it and where they need it, regardless of what system they use, because there is already a standard precedent, no, standard precedent that tells us how the information is gathered, why that information is gathered, how that data is sent, and how that information and data is managed. Diba? There's already a standard for that. So, today we will finish by discussing the primary goals and the types of standards commonly used in the hospital and healthcare. So the primary goals of health data standards are: number one, interoperability, understandability, accessibility, and security. Diba? Interoperability, no? Because the standard is set and everything is standardized. A system that uses a specific type of recording will also adopt this standard, and if they adopt this standard, that data can easily be transferred to another system, because as we said, no, the data is standardized, diba? We've already discussed that before. And because of that class, because the data is standardized across multiple systems, it allows understandability, diba? If you are a nurse and if the data that comes to you is similar or is standardized, diba, it allows you to easily understand it in a format that is very clear. It prevents what we call this fragmented information from coming through. Aside from that, there's also accessibility and security. We've already discussed this before prior, no? So these are just the primary goals of health data standards. Now, data standards are applied on protocols, procedures, terminologies used in healthcare, methods in healthcare, storage, and collection of data. I want to highlight here terminologies used in healthcare, because most of these class, they are very, very self-explanatory. Okay? The reason why we apply data standards or standards when it comes to terminology is so that it is easily understandable, diba? That's why in the hospital class, we tend to avoid using slang. We tend to avoid using slang, okay? We tend to avoid using jargon, okay? Instead, we have our own vocabulary, which is our medical vocabulary, diba? That way, no, standardized mo siya, because that way, let's say for example, when we say hypoxia, diba? When we say hypoxia, manggod, that is easily understandable, or that is easily definable by all, no? I would presume all. I would presume that all medical personnel would be able to understand that. Whereas, let's say for example, when we use slang, let's say for example for hypoxia, naingon siya dito, let's say, let's give a slang. Let's say for example, lumsi. Okay, lumsi. Let's say for example, slang na siya for hypoxia. Now, not everyone will understand that. Diba? Dili understandable. Maybe it's just inyuhara na sa inyuhara ng group of friends, or sa inyuhara ng station, di ba? Lumsi, no? But if we use medical vocabulary like hypoxia, no, hypoxia gid ang atong gamiton, we use the actual word, that is easily understandable across, no, everyone involved in the care. Aside from that, standards are also applied in protocols and procedures. That way, class, if you are a student here in the Philippines, we follow the standard set everywhere else, no? That's why even if you are a student here in the Philippines, when you migrate to another country, there is gamay na lang, no? Gamay na, there is very little work done when it comes to adjustment because you already know the protocols and procedures because there is a standard set on those protocols and procedures, di ba? So yes, that is it, no? We have 4 standards here that is very comprehensive. We will go them one by one. We will go at them one by one, but we will just give a general gist of them, no? So that you will not be overwhelmed. Okay. So first is the ICD, or International Classification of Diseases. The 10th revision of the ICD is the most recent revision. It is used as a database for mortality and morbidity, which is used worldwide. The ICD is used worldwide. It is widely accepted, used in the healthcare industry, and has been adopted for a number of purposes, mainly for data collection, quality of care analysis, and statistical reporting. Now, in the ICD class, since I said, no, it is a international database about mortality and morbidity, mga sakit-sakit, no? Classification of diseases, so to say. It looks like this. Let's say, for example, class type 1, diabetes mellitus. Now, in your ICD class, it will highlight there, or it will have guidelines there on how to accurately diagnose type 1 diabetes mellitus. Aside from that, it will provide a list or a classification of what signs and symptoms to expect in type 1 diabetes mellitus. This way, no, if there is a standard of classification of diseases, number 1, diagnosing a disease or a morbidity is similar, or no, not similar, it's the same across multiple countries, even multiple health practices, no? So because of that, sa yun na lang, it's very easy to understand, no? Aside from that, since there is a standard, there is a reference guide na, okay, so that we will not misdiagnose a certain patient. O, diba mo na siya yung purpose ng atong ICD, International Classification of Diseases. Next is our RX norm. Now, the RX norm class is a clinical drug nomenclature. When we say nomenclature class, this is how we use, this is basically vocabulary. Aside from that, it is also the naming scheme. Okay, naming scheme. Produced by the NLM with consultation with the FDA, or the Food and Drug Administration in the United States. Okay, the RX norm class provides standard names for clinical drugs and in what forms they are to be administered. Like for example, class, the RX norm might say there mannitol. Okay, nasa na dito class, ilang classification: osmotic, diuretic, diuretic. Nasa na dito class ang iyang forms. What forms they are to be administered? That's for example IV, intravenous. Okay. Aside from that class, no, RX norm class also provides links from clinical drugs to their active ingredients and components. Okay. Now, typically, we do not delve deeper into the active ingredients, no, because number 1, we are not in the business of manufacturing drugs. Diba? Dili man ta mohimog drugs, nurse man ta, diba? So, this is just a good to know. Diba? If you really curious, magbasa ka na, no? It's good to know. But mainly, this is used by our pharmacists, kana mga mag-develop gidog, kana mag-produce gidog drugs, no? So, that is RX norm. Next is the Unified Medical Language. It consists of a meta-thesaurus. When we say meta-thesaurus class, it is multiple thesauruses or multiple vocabularies of terms and concepts from a dozen vocabularies. Now, class, may mga meta-thesaurus class, it is a compilation of vocabularies. So, included na diha sa atong UMLS class is atong RX norm, atong ito siya, ICD, ko na napanay uban diha class, napanay siya SNOMED, napatay gitawag nga LOINC, kana It is various vocabularies, no? It is a comprehensive coverage. Its comprehensive coverage, semantic richness, and interoperability support a wide range of applications aimed at improving interoperability. Now, since it is a compilation class, everything is covered, di ba? Naatanan. That's why it is a unified medical language. Muna siya atong main nomenclature. This is the main terms, no? Nga rita magkuha sa itong mga main terms, main classifications. This is where we get it. Aside from that, no, there is semantic richness. When we say semantic richness, na ay ka ng mga na yung network, what we call semantic network. Like for example, sa atong RX norm class, let's say for example na dito sa atong RX norm, dito let's say for example metformin. Okay, that metformin could directly be connected to our type 2 DM, which was classified by the ICD. Diba? So mausa sila, no? That is what we mean when we say semantic richness, no? Na yung mga connections or links that connect these together, no? So mga na siya UMLS. A critical point in UMLS is interoperability. Diba? Interoperability. Sige na tagstorya balik-balik class about anang interoperability. When we say interoperability, good from the word itself, between, and operability is usability between usability in how we use it, no? So when we say between user experiences or users, no, it should be understandable by lots of users. That's why the UMLS is a great standard, because it compiles the standards of other standardization systems, and then combines them together into a single database wherein it is used universally. Okay? Muna siya nakanindot sa UMLS class, since naanatanan ni class. The reason why we use it is because, di ba, everything is included. No need to look at everything else, no? It is a medical thesaurus. Yes. And lastly, class, is ISO, the International Organization for Standardization. Now, I do not know why their acronym is spelled like that, nga, no, ISO man, when it is supposed to be iOS. But as I've read, no, it sounds more professional, man, good. It sounds more professional because when you say iOS, it sounds like Apple's operating system, diba? iOS ka na sa iPhone ba, no? So the ISO is an organization that develops and publishes standards internationally. Okay, the keyword there is develops and publishes standards. Publishes, they are the ones that will disseminate the standards. Sila mo yung magsulti or mag-spread the information about the standards. In case you didn't know, the University of Visayas is under the guidance of our ISO. Nagsunod na ta sa mga standard because one reason why we are following the ISO standard is we want to be internationally competent. Diba? Dapat ang atong standards, it must match with the standards set by the ISO, set internationally by the ISO, no? So in the instance of nursing class, the ISO creates an integrated reference terminology model for nursing. Integrates the reference terminology model for nursing. Like for example, the standard includes the development of reference terminology, such as for nursing diagnosis and nursing actions, as well as during implementation. That is why, class, even if you are studying nursing here in the Philippines, okay, ang imong nanda, class, your nanda, it will say acute pain. Okay? It will say disturbed body image. Sa imong nanda, sa imong mga nursing, disturbed body image. So yan. But because this is a standard set internationally, even if you are in the US class, we will still use the same term. So acute pain gyapon na dito class, and pan gyapon na class, acute pain gyapon na class, and this is also disturbed body image, no, because it is a set standard. Aside from that, dili ra na sa atong diagnosis, sa ato po na mga actions, di ba? Like for example, atong procedure for hand washing and gloving. Now there are certain steps that you have to take, di ba? Step by step pa na mga them, no? Yeah, we already know that, di ba? So kana ato mga steps, it is mimic, no? It is standardized internationally. So ang hand washing nga rin sa University of Visayas College of Nursing is the same as the hand washing in other universities internationally. Okay, mo na siya. Okay, nursing actions, no? Ato pong implementation, it is the same. Ang atong paghimo sa kanang atong kuan, mga na nursing care plan, it is the same. Adpay po na siya, or nang naibagora adupay. Okay. The good thing about ISO accreditation, ISO standardization is that if ISO accredited ang inyong organization, it means that when you transfer to another organization that is ISO accredited, chances are ang imong mga skills, the skills that you've learned in that organization, in the previous organization, can easily be used in the next one. Diba? Because you know, it is already standardized. So yan class, nabuan na class, sige na storyag standardized. Okay, that is it for your assignment class. I want you to pass this next meeting Monday, next meeting Wednesday, mag quiz ta. Okay, next Monday, which is next week, I want you to pass this to me. Okay, your assignment is very simple. You go to the library, okay, and I want you to go to the library. Ayaw mo pag do not go to the internet. Okay, I want you to go to the library, and I want you to look at common standards used in nursing. Okay, common standards that are not mentioned today. Okay, this is an assignment by group. Write this on a piece of A4 bond paper. I want you to put references. Like for example, you got this information from this book, yan na. And when I say put references. I do not want an internet reference. I want a book reference. A book reference that I can find in the library. Okay, do you understand? Okay, that assignment class will serve as an assignment for both lab and lecture. Ayan. So that is it.